Hello, everyone. Happy week 4. I am coming to you from my work break, but I thought I would dive into our discussion week's questions, exploring multiple relationships. And so, what do I define multiple relationships as? And so, I put professionals who might also be a friend. So, I think of coworkers. I also think of sort of from a different perspective, a professional like myself who works in a field such as epilepsy, and but also acts as a mother for a child. And so I think the multiple relationships or the exchange of sort of positions of profession and personal kind of intertwining make up the multiple relationships defined. I think they're complicated and tricky. While I love the idea of having friends in a working establishment and fellow co-workers being friends, it definitely is a blurred line for me from personal experiences. And so question number 2, let's jump right in, the ethical layers. So I love that it says multiple relationships aren't inherently unethical, but they are definitely challenging. So I can give a perfect example. So I had cancer this last year and had to be on leave of absence very unexpectedly in order to seek out treatment. And when I came back, my professional job was changed. And those quote unquote friends who were also my coworkers all knew, but no one really wanted to tell me about it. So it put a pretty bad taste in my mouth for, again, those multiple relationships or those coworkers who are also supposed to be friends, because I think it is important when you cross the line or try to be friends to at least sort of maybe in some way have warned me about the circumstances being changed upon my return, especially because I, kind of rushed back as best as I could so they didn't have to be gone for long. And I probably wouldn't have rushed back after dealing with my own cancer as quickly as possible. Then to find out my job has changed, all those people who, were checking in on me and trying to make sure I was okay, didn't kind of inform me. And so blurred line for sure, and changed my perspective on whether or not professional relationships can also sort of cross the line. I think they can in some ways, but I think I am far more guarded from that experience. And I think coworkers are or have the potential to be friends, but you definitely have to keep them at an arm's length and really still protect yourself and know that their intentions may not be completely forthcoming, which is disheartening from my perspective, because I thought you could do both in a professional setting, because what's funny is my supervisor, who was also my friend, could have just let me know that something was coming down the pipeline to better prepare me and to take maybe as much time as I need off because something might be different. So again, I don't think that they had to tell me exact details, but what happened was pretty awful and unethical and legal even in all the situations that it is. And that's a whole different story for a different day, but multiple relationships are complicated. And so I try to really remain professional in my elder years of life. Don't worry, I'm only 40, but I do think it's important to sort of be mindful of those relationships and sort of the cross blending of those relationships, keeping it really professional, while also maintaining some sort of, personal light relationship is important. But then important details, you have to be careful who you disclose those information or details to. So next question is the role of touch. This is a gray area, and I think a lot has to come down to factors of age, demographic, culture, circumstance. Working in healthcare, we try very much not to do any sort of touch that is, unprofessional outside of maybe like a handshake or even that, except for there are situations where, one, I'm physically touching people to do my procedures, but also in situations where you might have a grieving patient, I tend to just try to comfort them as best I can by putting an arm on the shoulder or in a way that sometimes seems fitting. However, it's not an exact science. It's not all the time. And I would be a lot more hesitant for the opposite sex or in certain contexts of situation where I feel like that line can be blurred. So I do know that there are benefits. After reading the chapter, it talks about non-erotic touch being appropriate. And again, I think it's those forms of sort of contact that are comforting in times of grief or hard positions, and that's where I have made those physical touches to patients, for instance, where just trying to comfort a parent or trying to help a patient who's kind of unloading or unburdening, to try and be sympathetic or empathetic with a fine line of just making sure you're not crossing the boundaries, because there are some situations where I've had, even from the reverse and working with, say, a patient who decides to be overtly flirty, it can make you pretty uncomfortable. So gray lines, lots of them, and for the most part, I try to avoid a lot of personal touch and personal, sort of feeling in the role in healthcare settings. Now, I do see where, as a therapist, I've been to therapy where, maybe I'm having a really, really rough session, and it's been helpful to just, have someone's hand on top of my hand, or times where sort of I've felt that need for a touch, but it's not all the time. I'm not a very touchy person personally. So, I kind of guard myself pretty tightly. And so I think that's kind of a gray line that would have to be explored and really thought about, in the situation. But without thinking about it, I can also say that there's, patients who might be grieving or going through a hard time, and I tend to try and comfort naturally. So in a way that, again, is professional and doesn't blur the line. So brings us to our last question, utilitarianism, and with regards to hospice care. So utilitarianism is just the doctrine that sort of our actions are right if they benefit the majority. And so hospice care is kind of interesting, because how I think of it in the healthcare setting is sort of where people go home to sort of pass away. And that can be both good and bad. It can be in their own home, in their own environment. And however, there is often a conversation about treatment and costs. And so basically the idea, that the patient's benefits are maximized with the most minimal cost at the end of their life, or, at the very end, when they might require a lot of, health care needs, where we could, throw them all at them in a healthcare setting. Is that appropriate when they're really towards the end of their life? And is that necessarily what they want? Or would they rather be at home and in the comforts of their own space with their own family and able to sort of pass in their own time? And so, for me, I see that hospice can have both a positive and a negative effect. But if I look at it in the form of utilitarian view, sending people home, because they're, about to pass away and at the lesser end of society, in terms of not maximizing the biggest need for healthcare. I think that's a very tough theory to apply to hospice, but I do see where the relationship resides. And so again, how can it contribute to enhancing the quality of life and comfort for patients nearing the end? I think, it can be positive in that it brings patients home, and they don't have to, go through some of those struggles of sort of getting those procedures if that's not really what they want. And so pros and cons, it doesn't waste healthcare professionals sort of efforts and working really, really hard to keep them alive, say, or take care of them. And it might also be mutually beneficial where the, client can go home and be with their family towards the end of life. But I think it's sort of individual for the family. I think it's individual for the particular person. And so something that really should be discussed too amongst, someone sick or ailing in your family, or even kind of the concept of what do you call it, when basically you decide what happens to you if you're past a certain point in your life. And so or say you get injured in a way that you won't come back for the same. So I can't think of what the term is because it's that time in the day, but the idea is that I think that may vary for individuals as to whether or not they'd want hospice care, or whether they would want to be in the hospital setting, and whether or not there's someone in the family or sort of a healthcare situation that can step in that hospice situation. But definitely conflicts between the idea of utilitarianism and the idea of hospice being for the benefit of the greater society, or the healthy society, or the society that's gonna need the care versus those who need the care at the end of their life. I think we should pay tribute to all those who have lived their life and try to make them as comfortable as possible in their passing. And so that is my discussion week for this week. A little shorter than last week. Sorry to keep you hanging on there, guys. But I hope everyone has a great week, and happy, what day is it? Monday. Talk to y'all soon. Thanks. Bye.